My audience knows I'm happy when we go live. And right now, Kol Beseder, which in Hebrew means everything is okay. So thank you, universe. Thank you, internet. Thank you, Dr. Deb Sumner. Thank you, Jeannie. I love you. I tend to get nervous and forget to introduce myself. So let me go ahead. This is TMS Roundtable Recovery. My name's Dr. Tovah Goldfine. I think this is like number 278. I mean,
Amazing.
we're going strong. We're not stopping. This is it. Forever, forever. Every week she went forever and ever into the cosmos. She just kept going and going and going. So thank you for supporting this program. And I don't really want to talk. I want to listen. I want to practice my listening skills and listen to Deb Sumner and Jeannie. And it is pretty exciting to meet. I just will say this. I will say something. It is pretty exciting to meet a medical doctor, a pediatrician. Come on, I got to say this. A pediatrician who like gets into some chronic pain and then decides to rearrange her career, her soul, her family, her life, and rearrange us and the people out there to help us all understand the absolute power and innate intelligence of the human body. So all that to say is just start from hello, like when it started and what happened. We like the details here. We want details.
Okay. I have to admit, I'm a little nervous about this. First of all, thank you so much. I mean, really, the opportunity to share my story and hopefully help people is worth any amount of nerves I'm feeling. So that's why I'm doing this. I do feel like it's a little bit of TMI, a little bit nervous about sharing some of that, to be honest. And I also might have my tissue. It's allergy season. I'm in Atlanta and my nose is going crazy. But yeah, it's so interesting when I was thinking back because in retrospect, when I was in medical school, we had a chance. I went to a medical school that really prized like learning about a lot of different things, and we had time to take electives. And most of my classmates and good friends chose a class in complementary medicine, which at the time, this was back in the 90s, it was just coming in vogue. And I was super interested in that. But there was a chronic pain and meditation class taught by this internist. And I was like, I didn't even know chronic pain, but I took this class and I was meditating every week with them. And he was telling us how he had patients who had their wisdom teeth surgery without anesthesia and all sorts of stories. And I did this meditation every week. And then, it was really cool. And then I really honestly didn't continue it and didn't really think about it. And then at some point during my own chronic pain journey, I was like, wow, that's so interesting that I had taken that class before all that started. But anyway, as an aside, I do talk in circles. So hopefully people will.
Please, we love it. We love it.
Yeah, I think trying to think back exactly because I wasn't keeping journals then, although I have at some point in my life. But I would say it was around 2004 or five. I think it was either between the birth of my second or third child. So I had three boys in 4 years, which was itself crazy. I said I'm from Atlanta. My husband and I are here. We moved here in 2001. We never had any family join us. We have friends and all, but like no family support. And I had these kids, and the births were pretty traumatic. My first one, I like all people, I want a birth plan. And I was like, no episiotomy, please. And she cut like a horrible episiotomy. And I couldn't walk for 2 weeks after. The second
You
one,
were a doctor. You were already a doctor.
I was a doctor at this point. Yes. Yeah. But I mean, the best laid plans, my sister's an obstetrician. She said the people who come in with a plan, I didn't have a birth plan. All I just said was, I really don't want an episiotomy, but I got one. Right. So my sister said, you come in with a birth plan, that's the people that, things go wrong. Anyway, the second one didn't have a plan at all. He came in 2 hours and, terrible, really fast, everything I identify with, all the people that have gone through no anesthesia, people have gone through births, tore really badly. I mean, this again, TMI stuff. But anyway, so I had these traumatic births. And then,
This is a safe studio.
yeah, but people are going to be
Right
listening.
now,
I
we just
invited
listen in
friends,
there.
people might listen. So the studio might be safe. But anyway, at some point I started developing like pelvic pain, like a burning pain, to be honest. And I kept going back to my OB, kept going back to the doctor, and they would test me for infections like over and over and over. And occasionally they'd say, maybe we see something, and give me a little diflucan, whatever. And this went on for a long time, and I kept just saying, like, God, it really, like, this is crazy what's going on. And eventually I went to the dermatologist and I'm like, do you see anything? And she's like, no, I don't see anything. She's like, but I've heard about women having this burning pelvic pain and they can't find anything. And there's this dermatologist up in Charlotte, North Carolina, 4-hour drive away, who is helping some of these people. So I was so desperate at this point, and my mom comes to visit for holiday, and she said, I'll drive up with you. So we drove up for the day. It was super nice of her. And we meet this doctor, and she said, oh yeah, you've got this, it's this nerve pain. You've got this thing like everyone has. And she encouraged me to go on like really high dose gabapentin, which is a seizure medicine that's very common in chronic pain now, and SSRI, like antidepressant. And after finding one that worked, because I had some side effects, I mean, the pain went away. I mean, it totally went away. And I was like, oh, great. Okay, well, I'm not in pain. That's great, because I'd been living with this really excruciating pain. And at some point, I think it was, again, second and third, I had a third kid. Again, another big delivery. Wasn't easy. Now I have 3 kids. One of them has severe medical problems. Like, it was a lot of stress. I was working part-time. My husband had traveled a lot again. So it was pretty stressful. And I'm trying to remember the sequence of all this stuff. But at some point, so again, I didn't have the pelvic pain. Oh, and then I wanted to go off the medicine. I was like, let's see what happens, because I've been on for a while. Let me see if I can go off the medicine. And I went off the medicine, and the pain came back. The pelvic pain came back. So I was like, okay, wow, am I going to be on this the rest of my life? That's really overwhelming, but okay. So I'm on the pelvic pain medicine. And then at some point, I start developing like I would call like burning nerve pain from my clothing, like my bra and other things. Sometimes around my hips, but especially like around like my bra area and everything. And I went to I'm trying to think. I think I found a pain doctor. Yeah.
Like 2 or 3 years, like 2 or 3, 4
No,
years.
I would say at this point, 3, yeah, maybe 5 years, something like that. 3, 5 years after. Yeah, but definitely after I tried to go off the medicine, I realized for the pelvic stuff. And when I went to the doctor, he was like, wow, this seems like herpes zoster, but it doesn't make sense because it's bilateral and, shingles, basically. He's like, it doesn't make sense because it's bilateral. You have it on both sides. It doesn't make sense, but it's, this burning pain. It seems like, and I'm trying to think what he did. Oh, and he said, it's really weird because I would prescribe gabapentin SSRIs and you're already on them. Like, that's so weird. That's so weird. And I was like,
Nobody at
okay.
this point is getting to the call. Everyone's just putting a Band-Aid on, and
Oh, of
you're
course. So then, I mean, and literally, I was also like, I mean, I knew about the opioid epidemic, and I'm like, I don't want to be on pain medicine. Do not give me opioids. Like, thank God I didn't take them. I would come home, like, they would e-prescribe, or I would get my prescriptions filled, and I started looking up what they gave me, and like, literally, they gave me opioids, like tramadol and stuff. And I was like, I was horrified. I was like, thank God I was smart enough not to do that. So I went down this pathway. I mean, I'm trying to think. I had some epidural, I had MRI, I had all sorts of, I saw a neurologist, like I saw all these doctors. And the thing is with this is that I never wanted to be my own doctor. I didn't want to be defined, and not to judge anyone. I didn't want to be defined as a pain patient. This is like kind of beginning of the internet. I'm like, I never went in chat rooms with pain people. I just didn't want, I just wanted to be normal, quote unquote, what I thought was normal. Um, so, but if someone told me, go try X, I would go try it. Go try magnet therapy. I tried magnet therapy. Go try fascial massage. This helps. Go try kinesiology, acupuncture. I mean, you say it, I tried all these various things. Yeah.
And how were you doing emotionally during this time, Debbie? Were
Yeah.
you,
No, that's a great question.
yeah,
So, um,
'cause you've got 3 kids at home and
yeah.
husband's
So,
traveling.
yeah. I mean, so at this point, I would say I would literally, like, I'd go to work, I'd go do stuff, and I would like parcel my life. So before, I used to be like busy, busy, busy. I would go do all these things. I never like didn't do stuff. Oh, I just broke my necklace. That's interesting. I would never not do stuff, but I would like come home. It totally broke. And I would like take a break. Like, I would come home, take off all my clothes, put on soft pajamas, get under a blanket, and like rest. And that would help for a bit. And then I'd go back out. And then I think I'm trying to remember. I went to someone, the acupuncturist, and she suggested I try biofeed. She did Reiki, which I had learned about. I had done Reiki a long time ago, and I can get back to that. But like, she suggested I try biofeedback, and she was the first person to be like, I think you're depressed. And I remember being so defensive and being so like hurt, like I'm not depressed. And I was really like, I really pushed back. Um,
Important
I,
to make that point because the ego
yeah,
can
I
be the
don't think,
biggest
I mean,
flaw.
I don't know if I didn't realize it, or I think there was a part of me that was embarrassed about it. Yeah, but I also don't know. I don't think I fit the definition of depressed that she realized. But I can see in retrospect that I
Yeah.
was being, shut down, and
Depressed is a
it's
big word.
overwhelming.
Depressed is a big word. You were overwhelmed. You were
Yeah,
triggered. You were not expressing yourself. I think depression is overused, but
Yeah.
yeah. And I'm gonna try to re-put. I did break my necklace, but I like the way it looks, so I think I'm gonna see if I can put it on while we're talking.
you can
So
do
what
five
are you
things at one. You can do five things at one time. Go ahead.
but are you on the SSRIs at this point, Debbie?
Yeah, so yeah, exactly. I'm still on the SSRIs. There, I can clip it onto the ring. I'm still on the SSRIs. She said that, and I think I'm trying to remember. I mean, it is really a blur because honestly, I was also sleep deprived. I was just trying to get by. I was in survival mode, right?
So
And
total fight or flight sounds like.
yeah,
Okay.
right. And I was like still doing all the things and still showing up, and it was really interesting. So then at some point, I'm trying to think. One of my neighbors had gotten involved in like energy work, like really like a place where they did like kinesiology, and like they actually did like gestalts, like kind of like inner child work where they, you would go to these retreats and they would do these like weekends where you would confront like relationships, and they'd have people role play. And it was really kind of out there stuff. But I'm forgetting why I brought that up. See, I thought losing my train of thought is so funny. I totally
That's
forgot why I
okay.
brought.
So we want to get to the point where someone said Sarno or
Yes,
neuroplastic,
where
and
did
you
this
were
come?
like,
Right. Yeah, no, it didn't come. So, like I said, because I didn't want to be my own patient, and I have some other weird pain stories along the way too. It wasn't until like really recently, it was 2021. Both of my parents independently sent me a Washington Post article that you guys probably know about with chronic pain
Yeah.
and curable being mentioned, and I was like, wow, this makes total sense. Like, I was so excited the minute I read it because I'm like, this is actually evidence based. There's research about it. These are doctors and neuroscientists, and not to dismiss other kinds of work, but like people actually sitting here looking at the brain, looking at MRIs, looking at research studies, and people are getting better. So I immediately downloaded the Curable app and started doing the exercises. And like, oh, really quickly, a neighbor of mine had told me about Sarno's book like 2 months before that. And she gave me a copy because she said, it's too small a print. I need to get the Kindle. I got the e-version. And I tried to read it, but the print was small and I didn't get into it. So I'd heard about Sarno for a minute, but then like 2 months later, like again, it was like the right time for this work.
Yeah.
So I started doing the Curable app, and it
here's
immediately
the
started.
thing. I want to stop and let the audience know that. I mean, you're
Oh,
a
yeah.
pediatrician. You're medically trained.
Yes.
You fix things that are broken. You work with children, so you maybe have a little bigger heart than other doctors. But like, what part of you was like, what do you mean emotional? This is
Yeah.
physical pain. I'm in danger. Something is wrong. The doctors missed it. I'm broken. Like, what part of you was open to like, hey, different pair of glasses. Something's going on in my brain.
Yeah. No, that's a great question. Well, like I alluded to, or like I told you, I had already done this chronic pain and meditation class. I did learn Reiki in 2000. Like the complementary world interested me, and I was in Thailand in 2000, and I wanted to learn about stuff. Long story short, some travelers from Australia were teaching Reiki, so I learned about Reiki. I thought it was interesting. I kind of practiced it on myself, and then in 2019, like I was trying to actually get out of medicine, started doing more Reiki teaching, and actually was thinking about leaving medicine. So I've kind of been in a world of believing in different stuff and being open to different stuff. But I think so being open to other stuff, but especially like I said, that model of like the fact that this was evidence based, like it really clicked. I'm like, oh, this is really different. Like, and it just appealed to me right away. It wasn't a big stretch, honestly.
You
Like,
didn't have a lot of doubts then, sounds like.
yeah, no, I don't think I did. Like when I heard the brain science and heard some of the story like, right away, I was like, wow. Yeah. So I jived into Curable. I actually then, this is during COVID. So I mean, it's like, it was January 21, I mean, it was like literally, still kind of just emerging. And I joined a Curable group like right away. And that Curable group, like having a cohort and learning together and just supporting each other and seeing their miracle stories. Like, I mean, their success stories of how people came in and, I mean, such chronic pain. One of my like compadres, like she was pretty much bedridden with multiple chemical sensitivities, barely could walk. I
Yeah.
mean, so much stuff. And now she's literally traveling the world doing all sorts of stuff. I mean, it's incredible. So, we still all keep up with each other. And I mean, so that, like seeing all that, I was like, I gotta learn more. So then I dived in and I'm like, I'm going to get trained. And I, took the pain reprocessing therapy class, but I was kind of like, I was waiting to see. I didn't want to pressure myself. Like I'm going to go out and do this. I just wanted to like be open and see what came, because I felt like part of what got me into the pain was being that personality, right? Like perfectionist, type A, pressure, all of the things that I had to be like. So I'm like, let me just be open to it. And I kind of just started talking to
So
people
what's
about.
going on with pain? Like you're still on this
Yeah.
GABA
How long did this
something?
take?
Oh, so yeah, I should tell you the good news. Right, I forgot about that. Thanks. I would say fairly early on, like during my curable group, so only a few months into it, I was feeling really good. And I'm like, I think I want to go off the medicine and see what happens. So I went off my meds.
Which one? Sorry, can you share which
Both. Yeah, both gabapentin and the SSRI. I can't remember what I was on at the end. I don't even remember. But anyway, I went off it. And the pelvic pain stayed away. So unlike that first time when I tried to go off and it came back, it stayed away because I had unlearned, I had rewired my nervous system. Um, the burning pain with the clothes sensation, that one is a little trickier. I mean, it can go away sometimes. It can, when I'm irritated, I mean, the clothes irritate me, even actually in the last few days, to be honest. Like, I think I might have been a little stressed about this podcast, perhaps subconsciously,
one?
consciously, but no, I have some other emotional life events, the news, the world. Like, I think everything was weighing on me a little bit and I was feeling a little irritated. And I'm like, okay. But I have tools now. I'm like, let me up. Like, I don't do somatic tracking every day, which I can explain what it is, but I'm like, let me do some somatic tracking. And I did some somatic tracking the last few days and it's gone down. So it's like, that's the beauty of it, is like knowing that we have tools that we can help ourselves, that our brain, like I just talk to my brain now. My friend does too. She's like, okay, brain, that's interesting. Like, I'm not sure what message you're giving me now. Or sometimes I know what the message is, but a lot of times like, yeah, I don't know, but you know what, brain, I'm good. I don't really need this one. Like, for instance, I felt like, tinnitus is a really big one that a lot of people have. Like one time I got like a little ring in my ear and I'm like, yeah, nope, no, I'm not doing tinnitus, brain. Sorry. And it went away. I'm like, thank God that one. I'm like, yeah, nope, not even going there. Right. Like, thanks.
Yeah.
So that was helpful. But, yeah, it's like nice knowing that when I get stuff, I can talk to my brain and
Yeah.
yeah.
And I think too, with just sort of, I had really bad back pain, and it was, oh my gosh, like nothing, like the bra, the belt, the pant, everything. I'm a small girl and I was like wearing gigantic everything.
Uh-huh.
um, because I didn't want like anything touching. And that's a really, as you know,
Right.
some people might not know, but that's a really clear sign of something being neuroplastic, of like just
Right.
that, because that's just like your skin, right? That's not like the muscles.
Right. Like
But I didn't know that
hypersensitivity.
then.
Yeah.
Mhm.
Mm-hmm.
Yeah, no, definitely. And then I want to know too, what was your thoughts when they're telling you, I'm just curious, because I was also told to be on antidepressants.
You're right.
What do you think as a doctor where they're telling you you're depressed, but you're on the medication?
Yeah. I mean, that's interesting.
Did you feel like you just had to get a better, different dose, or it wasn't working? Or did you know that this isn't this chemical imbalance that we know now doesn't?
I never really thought of the SSRI for depression, because when I had the pain to begin with, like really wasn't depressed. I know I might have been overwhelmed, but I wasn't like depressed that I'm aware of. I didn't have postpartum blues. I didn't have any of that. I was definitely overwhelmed, but I didn't feel like feelings or sadness or any of that. And so I kind of thought of it for pain. When that woman who was a biofeedback person told me about the depression, yeah, I mean, I probably was like, well, I'm already on it. I think I was honestly so shut down that I didn't even recognize,
Yeah.
like, I didn't even believe what she was saying. Like, I remember being very upset. Like, she must have been like, God, she must, like, I laugh now. She must have been like, God, this woman was so shut down. Like, she didn't
Yeah.
even realize it. But, this is where I was. So,
Yeah, I wanted just to highlight the I'm saying anti-anxiety, but the SSRIs for a second, because I think like I got offered it a few times, and I think it's important maybe for people to understand that like whatever like best for them, and what they think, but we look at depression as, something of a TMS, mind body, but also what happens. And I've worked with clients that are on SSRIs. It does make it harder to feel, right? So it could be a little bit, and everyone's different, but the SSRI does tend to like numb some of these emotions. So when we're working on a deeper level, where in your body are you feeling sensations? Where's your sadness? Where your anger? It can be a little bit harder to access. So I just wanted to share that if that's you, then that's just to know that that's normal if you are on the medication.
Yeah, I have a family member I've told about this work, and I got them the Unlearn Your Anxiety and Depression workbook by Dr. Schubner, and they actually went off their anti-anxiety med. So again, I'm not like, if people feel like they need
it's whatever they need.
like, diabetics and insulin, I mean, there can be chemical stuff, but I also do think that, depression, anxiety has been shown to be super, like with this work, that people can feel so much better with the mind body, pain reprocessing.
Right, but they have to feel.
Right.
Tovah, they have to feel. And if you're taking medication that's going to like knock out the feeling, I could just see how this could be problematic to people.
But you know what? It doesn't, there's no black or white, process and set of rules. Somebody can heal on medication. Someone can, be smoking joints and still heal. Someone could be, on, I think it's just, that's what I think can trip people up is that it's just, and I think all the docs would say, stay with the medicine if that's helping you do, because what trumps everything? The thoughts.
Right.
The thoughts. And, the SSRIs or antidepressants don't take away all your feelings. They numb you, they help you, they assist you.
Right.
But, we can still feel. I think if for anyone who's really ready to heal, none of that's really going to matter. And I think it's important. I want to make a point that I just read this, and I love, I feel very privileged I study with Dr. Hanscom, and he's kind of this nutty professor,
Right.
And he's brilliant, and he's studying all the mind body unit. He does, he had his own journey, and he's really doing an amazing work with emotions and anger and thoughts. He really covers all bases. Play, how important play is.
Right.
You have your 3 boys, so I'm sure you're your play in. But here's the thing, and I'll quote this. He said and I asked him for the science behind it, and you probably will relate to it, that we don't have the mental capacity, we don't have the ability to connect to our feelings. Like it's easier for us to be in pain than to be connected and to feel. Like it's almost like our brain and body can do that better. But when it comes to like, okay, I'm ready to feel, I'm ready to feel my feelings and not think my way down there. That becomes something we're not trained. We don't have a muscle. We didn't see it growing up. We're not blaming any parents here. But I think it's important for us to understand that. And whether we're taking the pills or not, or smoking marijuana or not, whatever, I think we can still get there.
Right. Now, I think that's what they often say is, hey, do the work, and then, if you can come down on it because you've done the work and everything. But I also just completed, I took Howard Schubner and Mark Lumley's class on emotional awareness and expressive therapy. And that technique, I mean, really, I think getting at the emotions, like it's amazing how much unresolved emotions are, correlate with pain. And that, like the research study that where people were shown pictures of like a bad traumatic breakup, pictures of their partner, and it lit up the same part of the brain as when they were getting poked with noxious stimuli. I mean, it's amazing.
Well, look, if you think about it, now that we know about safety and threat, when we're sad or angry, and you have a sensitive, highway from your conscious mind to your unconscious mind, you're going to get like your brain is going to protect you. And again, I always say like this sounds a woo woo, but then
Right.
Scientists have studied that pain is an emotion,
Right.
and we understand that where our brain perceives things, and if we're
Did she freeze? I think she froze a minute. Uh-oh. All right. Well, while I will actually keep saying while she's there, and I also see that I don't know when she goes in, but I see some comments. I think I see some people I know in the comments, which
Oh,
is
good. Say hello, Debbie.
I know. I'm like I'm saying hi to everyone, but I think I have a question I see from Alita, my friend Orit, which I see she's actually from Israel, which I invited her. I said, hey, I'm doing a podcast from Israel, and I see some other people maybe related to you.
So
yeah, I got some family here, but Marla, I agree that even though we know it's hard, Debbie, for you to share the TMI, it's really helpful. So you're helping others because no one talks about these things, Debbie, and then no one thinks that anyone else, right? So
like having coffee with
what
your,
you feel comfortable with.
Your fear.
Yeah, I've been there too. Once I started sharing things,
so
people would message me.
Them can come back.
That's a good idea. Yeah, feel free to message me. For sure. My website. I can mention all that later, but.
Remove this for a minute until they come back. Jeannie's coming back in. Yeah. Yeah. Not sure what's going on. So, wow. Okay. Anyway. So, I want to answer your questions until my people come back into the studio.
Tovah, are you there?
I'm not sure what happened. But let's try again. Come back in, Jeannie.
All right. Did you leave too? Were we all cut out?
I was here, but it was kind of reconnecting.
Yeah.
Okay. Yeah. Okay.
Well, we can keep
Listen,
going.
I'm just going to go out.
If she
Stay
texts
with
me or what, if maybe she wants us to exit
out
and come out again. Do you want to answer this one question from Marla, or do you want me?
Can you read? I have to get my glasses. And
sure.
Mind saying?
Yeah, she says, Marla says, would you all please comment on any differences between tension myoneural syndrome, tension myositis syndrome, Tovah looks like she's back, and mind-body conditions?
Okay, let's see. You guys are still there.
That's a great question. I feel like there's so much terminology, and it's a lot of times they're overlapping, and there's a lot of different things. I know TMS was what Dr. Sarno said, the tension myositis or myoneural, and I typically call it mind-body or neuroplastic. I don't know if there are differences. Do you know more about that?
Yeah, I mean, tension myoneural syndrome, tension myositis syndrome, those are the same, TMS. I think sometimes mind-body, I mean, I say mind-body too, it just depends who you, now I'm using neural circuit pain because I'm,
oh my God. How did you, what just happened? Oh my God.
We brought you back.
Yes, you went out in the universe and we've been chatting, so it's all good. We're answering questions.
Stay with us. So I went out or you went out?
You went out.
All right. Yeah, I really like.
Oh no, it froze again.
She's freezing. Okay, so keep answering, Jeannie.
Yeah, so tension myoneural syndrome, tension myositis syndrome. Yes, that's from John Sarno. Now we look at it, syndrome. You're probably the expert since you're a doctor, but I don't know what syndrome means exactly, but now we know it's not a syndrome because of some way that syndrome is defined. I mean, I would say, like I was saying before, like being in Howard Stubener's world right now, everything is neural circuit. That's can you hear Tovah? Yeah. But some people are calling it neuroplastic. But I think sometimes mind body isn't really like pain, right? Like I could, if you were really nervous for this, today, it's like you have a little nausea or someone's face gets red. And I don't know if you would say that's TMS. So I think there's mind body in anything, right? So if someone has cancer, that's not TMS. But if they have cancer and they have a lot of stress, that can affect. So I think having a mind body can be used both ways if that's helpful.
That's a good point. Yeah.
Yeah. So if we're talking in this world, we might say mind body, but then sometimes it could just, a little tummy ache because you're nervous about something. Yeah, there's so many. I know, unfortunately, there's so many terms.
It's funny because one of the doctors doesn't even want to call it. He wants to call it nocia plastic or not nocia circuit or like really. And I don't really think the name matters. Do you? Deb?
No.
I don't think it necessarily matters. I think it's a little confusing because there's so many different names. People are like, wait, is it TMS? Is it this and that? When I posted about your talk, someone actually thought TMS was the, what is it? The magnetic that people use for depression. So that, again, there's so many different terminologies and they're overlapping. So, but I wish there was one that we could agree on. Neural circuit's a nice one too, actually, because that kind of neuroplastic.
But I wanted to make a really important point to some of the listeners and to what you said about how you still get, sensory sensitization. You probably have a little CSS. I think we all have a little CSS, a little sensitive certain times when, especially when we focus on it. And I also learned this from Doc Hanscom, that these pathways that are created, that pathway that was created and what Jeannie has had created with her fibromyalgia and CFFs, that pathway is always there.
Right.
It doesn't go away. We learn to create a new pathway, a greater pathway, a stronger pathway that becomes our default. So that's what I think is, so for people who want to get rid of their pain or to stop their pain, I think it's so important to understand the science. Let me
Right.
chat a little bit about it so people can feel empowered that the pain is not against them. That's actually a great sign that you're alive, that you're feeling, and that you need to have a relationship with the pain. So can we chat a little bit about that so people can feel encouraged and inspired?
Yeah, sure. I mean, pain, I know it is complicated, right? Like pain is a protective mechanism, right? If we put touch our hand to a hot stove, our brain gets sent a signal, oh, take your hand away from the stove. And, Dr. Schub and other people talk about all there are people born without the ability to feel pain, and they can, really suffer from third-degree burns and really dangerous things, right? So pain is a protective. It's just it gets put out of balance. And, with people with, chronic pain, it's sort of the pathways sort of get stuck, the brain pathways get stuck in that, fight, flight, or freeze, and we can unlearn them, create, like you said, new neural pathways. I can share another really cool story that, again, I don't remember exactly, some point in my journey after I started healing on my own, I woke up with some neck pain. And as you said, my Western medical brain model was like, oh, neck pain, what I do wrong? What do I need to fix? I'm like, maybe I slept funny. So that was in the morning. I think I had to do something. So I did pop one ibuprofen and I went about my day. And by the end of the day, my back, I guess when people talk about throwing out their back, I don't know if that's what I did, if that was what they mean, but my back was in such spasm that I literally couldn't bend over. Like I was in tremendous pain, and I didn't realize, like, when you get out of bed, you don't think, so many things are automatic. I guess you sit up, you kind of bend over, and I literally couldn't bend over. So I was like trying to get out of bed in the morning, and I had to like literally slide off like a snake and drop to the ground because I mean I was in so much excruciating pain. And at that point I was like, okay, Debbie, like this has to be mind body. Like there's nothing you could have done. Like you just didn't do some crazy even if I had an excuse, like there was no exercise, no like nothing. Something must have come on. And I'm like, what's going on in my life? I'm like, I don't know. So I'm like, body, I don't know what message you're sending, but this is, and I put on my somatic tracking, recording from Curable, and literally within 24 hours, no more meds, all gone. I mean, it was incredible, but I was like,
Yeah.
that, like, and again, that's all evidence for me. Like, wow, this stuff is real. This works. Like, this is our brain just, trying to protect us for whatever reason. And we have the power, as you said, we're empowered to unlearn these things. We don't need to live in pain. I love the idea. We talk about pain management in Western medicine. We don't need pain management. We can really unlearn our pain. And that's not to say that we'll never have sensations, that new things won't come up, but we don't need to, be in chronic discomfort at all.
Yeah, that term. I always cringe when people say management for stress too, like manage your stress or manage your emotions. I always kind of, they're not to be managed, they're to be felt and released. But I think that's a really good point, Debbie, to reiterate that if you know where something happened, right? Like if you got into an argument with a loved one or family, great, maybe this is causing stress or there's emotions you have felt. But I really want to emphasize that you don't have to figure it out, right? You can I always say, ask your subconscious maybe once a day, what is this? What am I not wanting to feel?
Right.
What's this here to protect me from? Maybe you journal on it, but without that pressure. And you can heal without knowing. I think a lot of people get really scared. They got to like figure it out. And let's go to my childhood trauma and wounds. And
right. Yeah, I had no idea with that one. I'm like, I felt fine as far as I knew. Nothing major was happening. But yeah, I don't know.
What people also need to know is, because I think all of us are working with, various clients, like there are people who will not have that rebound. Like I've had chronic pain things, acute pain things happen like for no reason, and I was able to move out of it with a funny movie or something because I was in touch with what was going on. But there are people that are highly intelligent that are not figuring it out. They're not getting out of it. They're staying stuck. They're staying down. And, and this is another level. And Trubiner even made a statistic years ago. He told Rose and I, like 40% of the people that do come to us that are absolutely neuroplastic are not recovering because they're in that percentage that are tripping up on themselves, not getting there, like too perfectionist, too in their head, lovely, important, beautiful, smart, sensitive people, but not able to shift through it. So what can we say with your knowledge to these people? Like, first of all, don't give up. What else?
I think sometimes what I see is when people aren't healing. Yeah, I mean, sometimes it's like peeling the onion, right? Like there are just layers of things you have to get to go through. And I do think the emotional work is a strong piece. Like if you can, I think that emotional expressive technique really is a helpful component because it really just digs at some, it's like deep inner child work a lot of times, some healing where you bring your current self back to heal some old things that you don't realize are stuck. But I also see people kind of still, it's like they're dipping their toe in, but they're not fully believing. Like they're still going back to the Western. And again, I'm still for Western medicine. I am all for you have cancer, please take the chemotherapy. I'm for vaccines. I'm saying that on the radio. I'm definitely for a vaccine. I'm not, woo 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 woo. But I think in this case, I think when it comes to pain, I think people are jumping like, oh yeah, I'm going to do this work, but let me go get another injection. I'm going to do this work, but let me go do this. I'm going to do this work, but let me go get that. And I think, not to say you shouldn't try those things, but I think if the really reliance is there's something that needs to fix, I think it's hard sometimes to heal this way. I don't know. That's one of my thoughts, but
Ethnicity for some people that just cannot move forward, and what can we leave them with after speaking with Deb? What do you think? What are you thinking?
Oh, sorry, you broke out just for a second. Are you
Yeah,
asking me,
yeah,
Tovah? Yeah.
yeah. Maybe I'm speaking low, but
Yeah.
what's going on? What are you
Yeah.
thinking? We talk about
Yeah.
this a lot, you and I. Like, what can we leave our listeners with in order to?
Yeah.
Because this is the answer. I'm sorry, this is the
No,
answer.
I'm like you, Tovah. I'm like, and I'm gonna be honest. Like, you know me, Tova. I get really passionate. I like want to save everyone, and like really, and I'll say like
That's how I want to save everyone. No, 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 no.
I want to save everyone, and I can't. And I know I'm being like, but like when I know you and I are like, we know someone has TMS, and I feel like it's my look. I suffered 16 years. I don't know if you know my story, Debbie, but I had 16 years, right? So when people come into my world and then they have doubts and they're not sure, and it's so clear cut,
right.
I
Yeah.
try so, and I'm really
It's like we're in a cult or something, right? Like, please listen, but it's not a cult. It's not.
Yeah, because I don't want people to suffer. Right. And this is not just themselves, it's their family, their career, money, everything. So I've really kind of done some a little internal work a little bit of, you know what, I'm going to help people when they're ready.
Exactly.
Because I'm,
yeah,
I mean, I can't, right? But I think to your point, like really just emphasizing, like, of course you have doubt. Of course you have doubt. Like everyone has doubt. Like Dr. Schubiner says, I think Alan Gordon or Schubiner is like the only ones who have 100% are the ones who on the other side probably. So it's okay. You have doubt, but I don't want that to stop you. Like Tova says, like if you've been and it's so interesting because there's so many tools now we can use to diagnose with like the fit criteria, and there's all these, I think a lot of coaches have different quizzes and different doctors have quizzes. And so I do this, and sometimes people, they still doubt. And so I think I mean, maybe you're just not ready right now. I mean, unfortunately, like I can't.
right.
So, but this is the path. And so find someone, and I'm often like, well, work with some, Dr. Nicole Sachs would like borrow my confidence, right? So work with someone who believes that you can heal. I mean, and I've talked, Scotty, him and I have like talked about this too. Him and I are like, we just want to help people. But I think, there is a point where people have to be ready. And if they need to just take a beat and read some books and just lay off, but this is the path, and the doubt is part of the journey. But at the end of the day, this isn't about your symptoms. I just want to remind people this is about the stress. This is about the emotions. This is about maybe the trauma. This is about so people I'll just say like what I do see, which I wish I could just like, get this. It's not about the symptoms. It's just not. And people focus way too much on the
right. Does this work for me? Does this work for me? It doesn't matter. It'll work. Yeah, like it's about not the
it's not
specific.
about the symptoms. So people like, Jeannie, but this happened and this happened. It's not about the symptoms. This is something way deeper, and just take your first step. Like, you don't have to know all of the reasons and all of the healing, but you will, like, as you keep going with this journey. So I just want to emphasize, it's not about the symptoms. It's about what it's trying to protect. And you've got people who will fight for you. But I've just decided energetically, Tovah, that I want, you can't force someone like to work with you. And it can just be like so clear as day when someone has it. I had someone come to me who had so many appointments and so many like evaluations and nothing. It's like very clear and obvious, and pain's moving. But they gotta want to do this.
And I want to just say that it's about, you are the solution. You are the problem and you're the solution. And when we can own that and be so responsible in a, like, not a blaming way. Like I met a woman who, like, and I meet lots of people who, they care for their dog more than they care for themselves.
Yeah.
Oh my God. I said, if you talk about that dog, I said, because how dare you? How dare you? Like, this is your life.
I know.
So they know how to care. They know how to love. They know how to be compassionate. And so why? I ask this, why? Not why, but can we be curious? How come we have to learn as adults how to be compassionate? Like, it doesn't sound like compassion was an issue for you, Deb. You weren't being mean to yourself. You weren't being hard on yourself.
No,
You were just.
I have an inner
Okay, so
critic.
let's talk about it.
I have an inner critic. I'm perfectionist and self beat up, and judgment. My name Deborah means judge. Hello, I mean, I was aptly named.
True, in Hebrew it means judge.
That was. I mean, working on the inner critic and not being so hard on myself when I make mistakes. I mean, that's been huge. Like, I made a big financial mistake recently that, I was like, I would have like crushed myself earlier. And I was like, I tried to rectify it, but I was like, you know what? Like, thank goodness I can handle it financially if it, and I made a mistake. I'm human. And luckily it was able to work out, but I was so proud of how well I handled it. Like, not to say it was perfect. I, spiraled for a minute, but it was like a minute as opposed to, when I say minute, it was maybe an hour or two, but like as opposed to days, which it would have been. So I also see there was a question. Can we go? There was a question.
Yes. Marla. Do you know Marla?
I don't.
Welcome to the broadcast. She has a couple questions for you. How often do you recognize TMS in children, and how do you proceed with treatment?
Well, that's a good
question. And are you working, Debbie, as a
I'm actually
pediatrician right now? Okay.
I am not. I do think, and I also want to go back to Alita. There was a question. I do know Alita, and there's a question I want to get back to her too. So I worked for the public health hospital, outpatient clinic here. And to be honest, a lot of my patients were just in survival mode, and I did not see a lot of chronic pain or chronic conditions. I think a lot of times, some of this work tends to be in people that have more time on their hands or more means or something. Although we certainly are seeing, that, in veterans and PTSD and a lot of chronic pain in patients like that as well. But, I mean, there's certainly in teenagers, we're seeing a lot of, POTS is now a huge, huge thing we're seeing, and other things. So I do think it is more common now. That is, like I said, one of the reasons why I'm on here, even though I'm fearful. Like, I've spent a lot of time now talking to my medical school classmates, my colleagues, other people about this work. I would say a few of them are willing to listen and read about it, learn about it. A few of them are on board, not necessarily wanting to do the work themselves, but just on board. A lot of them aren't really even looking at it yet. And I can't wait for the revolution. I can't wait for the paradigm shift, as that awesome YouTube video that all the greats have made. But, the idea that this will be the pain science. Like, this will be how we treat pain, I hope, sooner rather than later.
Yeah, a lot of kids, teenagers, young kids, the migraines I've heard a lot
too.
Migraines
too. Yeah. Dysautonomia, migraines.
Yeah. It's excellent. I'm gonna put it on. It's out. It's on all the Facebook lately, and I'll put it out later. Dr. Shamir talks about POTS and
right. I just heard that.
And I didn't realize this was so apparent, but he talks about this so what do you say, socialization, like if one kid has something
Right.
contagious, so social
Yeah.
contagion,
Yeah.
one that may that it's and we but that's it's almost hard to believe that. I don't know if someone would get POTS from another child, but there is look that the example he gave was that people were getting ticks and then other people got
Right.
ticks.
From
That's something
TikTok,
different.
right? Yeah.
But anyway, but the fact I think a fact I want to make is that POTS you can recover from POTS with this work. That's the most important thing.
Well, the thing with POTS, I mean, you think about it, right? Like I got dizzy as a child, right? Like I got dizzy a few times. I actually passed out a bunch. My mom actually never really took me to the doctor. A few times I was sort of sick or, got up really fast from standing and it was kind of like, oh, it's fine, right? But if you're told like, uh-oh, you're dizzy and then everyone's like panicking, like your heart rate's wrong. Well, I mean, he explains it really well. Well, then, and then you get nervous about every time you might feel dizzy. Well, your brain starts wiring, uh-oh, I stand up, I feel dizzy, I'm nervous. Whereas maybe
Yeah.
you got up too fast. So, Rachel Zoffness has a great workbook for teens too. So, I mean, they're definitely people working.
Or just Dr. David Schechter for teens.
Okay, cool.
Very, very good. Yeah.
And Alita had a question. I think it was about EMDR versus curable. I don't know if you guys have thoughts. I think EMDR can be a great modality for dealing with trauma. I think it could go really well with curable. I think there are different ways of getting at things. I do think the somatic tracking with curable is a really helpful technique. And I alluded to that earlier, but the idea of sort of looking at your sensations, your symptoms as a detached third party observer really helps give the brain messages of safety and really helps the brain like rewire the nervous system. I think is really important. So, but I think they could be worked on together. I don't know. You guys have any thoughts about that?
To the same thing. I think what resonates with you, what's going to help you. I mean, someone just told me what helped them the most. Oh, a woman she's going to be on the show. The woman we're going to interview, she had a super horrible reaction to getting COVID, and she was 2 years on the couch, 2 years on the house ridden, 8 months on the couch. Her brain fog was so great she couldn't read a menu.
Wow.
And what helped her the most was visualization.
Mm,
So that's another way where the brain thinks
right.
so again, we're speaking to the brain, we're calming the brain down, we're understanding that the threat is a perceived threat. We're pretty much doing the similar thing, exposing ourselves to these thoughts, talking to the brain, journaling. I think exercise is very important to get out there, and even if you're walking around the dining room table, I think it's just not black and white, but the general program is so effective and makes so much sense. And I
Yeah,
think
I cut you off, Jeannie, because I want to ask your opinion. But I think that is something I do tell people because they're like, "Well, what is it? What's the work? What is it?" And I'm like, "Well, the thing is, it is a little work, right? Like you have to work, and there's not one modality. There's no magic pill. There's no nothing. It's a little bit of journaling. It's finding joy and gratitude. It's talking to your inner critic. It's doing visualization, mindfulness." Somatic tracking, emotional expression, like it's all of these things. And yeah, what works, and maybe something works at one point and then you lean into something else. So it's not totally linear and it's not totally straightforward, but it works. I don't know. What do you think, Jeannie?
Yeah, I don't have any experience myself with EMDR. I've heard from clients sometimes it's amazing. Other people haven't had great success with it. So I think it's a tool, but I think I just think sometimes in terms of people healing all their trauma, I sometimes people come into this work and they're like, okay, I'm going to work with the coach. I'm going to do this. I'm going to heal all my trauma. And so me personally, I think, maybe EMDR seems kind of a safe approach. It's not, but people when they're in like deep therapy with like trauma healing and stuff, I was like, let's just get you, out of pain for now, right? Let's get you more in a regulated state. In my experience, like I have a client who has a lot of trauma and she had horrible fibromyalgia. We got her back pain-free. She's not crying every day out of pain. And then she did the deeper emotional, like trauma work, because she didn't have the capacity. Like, obviously her body's on fire everywhere because of her, of the fibromyalgia. So I think, and this is just kind of my opinion, when people come in with like a lot, you can get better without doing the trauma work. But if it appeals to you, right, to do everything it just can be a lot. It can be really intense, and certain, like, I'm very much like body based. EMDR seems great, or doing things. But if you are doing like the deeper talk therapy or trauma work, that could be a lot, right? Because you're talking about things that are traumatic, but then you're bringing safety to your body. So there isn't, like you said, a one size fits all, but it can be where go down the PRT route, start to feel some of your emotions. Now, as the pain's decreasing, now you can really go in for a deeper dive. So I just think that it depends on what your body can handle. If you've done some trauma therapy or trauma work before, it might be easier. But if it's like brand new, like someone is like brand new, there's a lot to unpack. Right. Just get out of pain first. Like, let's just rewire some neural pathways, and let's have you feel some sensations that are coming up now. Right. And then all the other ones, that's good, but let's get you feeling better and more regulated now. That's kind of my sense.
Yeah, in that same vein, not to disc therapy, because I'm a big believer in, cognitive behavioral and talk therapy, but I know there's research studies that show both pain reprocessing therapy and emotional expression are superior to cognitive behavioral, and also superior in medicine for getting out of chronic pain. And just anecdotally, like, I was doing this virtual training, and all the therapists in the group, they'd be like chatting, like, we have 20 years experience in, CBT, cognitive behavioral therapy. And I just tried the emotional expression this week, and my patients, like, my clients are like dramatically different. Like, it's unbelievable how changed they were in terms of their pain within like a week or two. And I mean, again, anecdotally, but over and over in the Slack channel, therapists were just saying how incredible it was for helping their patients move through chronic pain. So,
And then because Marla mentioned Dispenza, which I lean into Dispenza work and the quantum, especially for people that maybe are stuck in their head. I'm like, okay, we're going to go to the quantum now. First of all, you've been the placebo the whole time, and you're still the placebo. And two, and like even Gabriel Mate in his own way, especially Dispenza, and I know even Hanscom, they're not going to go deep into the trauma. It's like, you're an adult now. That's that. You're safe. So, like, how much do you want to go back there? Let's just integrate the past into the present and move on. Like, and that's another way for some people, because for many people, and it sounds like it could be for you, like, something happened recently, like the births of your sons, and maybe like your childhood, this or that, but that wasn't really, nothing was going to happen. But this was sort of the straw that broke the camel's back. So it was kind of like an updated adult. This is one idea. So people don't always have to dig deep and feel like they got to find it out. Like, again, it's such an organic process. So, and I fully believe in the law of attraction and mental rehearsal, visualization. And look, I lean into a lot of the autoimmune. I'm working with some CSF people, and it's like unbelievable. Long COVID, like, people are suffering so much, and they even, and this work is helping them.
right.
The neuroplastic work, the somatic tracking, that it's helping them calm their brains so their immune system and their stress hormones can, build themselves up. So this is really helping so many people with so many, because this is hypnotherapy. We're not even talking about anything. This is God. This is about innate intelligence. Don't get me started. So I'm drawing in because Trubiner said in this video about how like thousands and thousands of people are suffering from long COVID, and COVID's done. We're done, and yet we're dragging our ball and chain with our immune system. So.
Yeah, that was a particularly enlightening episode. I shared that with so many people, where he really talks about long COVID, chronic fatigue, chronic Lyme, POTS, all the things. It doesn't matter the symptoms. It's all the brain trying to protect people. And it was amazing.
Good point. When it comes to people who want to know the symptoms, like, it doesn't really matter. Like, let's just get to the cause.
Yeah.
That was was that a Curable episode? Do you remember?
Yeah, it was like body.
Yeah. What's her name?
Yeah. with Christy Weepy, and you could find it on Spotify, podcast, Apple Podcast, wherever you listen to your podcast. I think it was
Yeah.
fabulous.
And I think too, going back to EAET, I just used it this morning with the client, and I do stress coaching and chronic pain coaching. So she doesn't have chronic pain.
Mm-hmm.
And we did it today with like she's in, a very difficult situation right now. So no chronic pain, but there's some anxiety, of course, and it affected her sleep. So, I mean, these tools are just so beautiful because they're not, this is the vibe a lot. Like, how do I get out of chronic pain? Like, what do I do? And we get it. We bring compassion. It's not about the symptoms. It's about like the journey, who you are to be on the other side. It's not people just say, oh, I just want to be chronic pain free. I want to be pain free. But if you do this right, and Tovah knows, like it's who you become, because you have to have more self-compassion. You have to slow down. You have to feel your emotions, right? So just this work is life-changing, and I'm using it with people who don't have TMS or the typical like pain, right? Because feeling your emotions turns out is a human, it's a human thing. It's not
Wow, really?
I think you both
did you
could
know?
admit.
I know. Sorry, Tovah?
Both of you probably could admit having had chronic pain, which I didn't, but that you cannot get out of this without being someone different.
Yeah, what got you here isn't going to get you there.
Yeah.
And like for the moms watching, which you ladies are, right? I'm teaching this to a lady who's going through a very difficult time, and that it's okay. She's so sweet, and I'm so sweet, and all of us are so sweet. And having like anger thoughts is not what a good girl does. There's being
Right.
angry and letting yourself EAET, like do the damn thing and say the thing, right? It's so freeing. And then I said to her, why don't you practice this and then teach it to your daughters, right? Because they're allowed to know that it's safe to have emotions and safe to be angry, and you don't have to feel guilty for imagining, right, something. So it's just, this work is life-changing for people who are not even in chronic pain, and it's healing on so many levels. Yeah.
So, Deb, you are part-time doing pediatrician work?
No, I actually left medicine. That was like a big movement because
Wow.
I think we need doctors and all, we need all sorts of people in healthcare, but I was really looking to leave medicine because while I loved the relationship with my patients, my favorite part of my job, honestly, was I had gotten a grant, and I was able to give out books to the, like I said, I was in a very low income clinic, and so I was able to give out books when they came for their checkup, so that they would have 10 books by the time they got to school. And that was like my favorite part, was like trying to like level people up and everything, but the medicine part just really wasn't doing it. And I was doing it in Spanish, and I never learned Spanish really well, so I was like, but I knew enough to, but it was just like, it was taxing my brain, and I was really stressed with everything, and it just wasn't serving me. So I really was like, I want to get out. It was a big movement to be like, I'm going to leave a respected field and leave the traditional financial gain, all that. So that was actually really a huge deal to be like, I'm going to go out. And at the time I left, and I started just seeing Reiki clients, and I do on it. People keep asking me, and if people are still listening at this point, but people are really confused when I say, because I think Reiki is a great like healing modality. I think it can produce a lot of relaxation and everything, but it's different than this pain reprocessing, totally different than this work. And I think when people think I'm doing this, they're like, oh, you're doing your Reiki. I'm like, no, I do Reiki, but that's not this. Like, this is a much bigger body of work that's like really evidence-based and everything. So
You're practicing? Are you seeing clients?
I practice not medicine, but I do see Reiki clients, and I've started taking on pain reprocessing. Trying to help people through the the pain process. Yeah, I know it's all new in the last few months, and I've been helping clients and using the emotional expressive techniques and everything like that. So
Reiki is a way they can access it.
yeah, yeah. So some of them choose to do Reiki and combine it with that, and some of the people are just seeing me traditionally with.
And maybe we're going to disagree here, but like, does something have to be always evidence-based for it to like?
Okay. Yeah. Well, again, I guess that's that Western part of me. No, I tell people, like, I don't know how Reiki works. But in terms of, I guess the reason I'm making the distinction, and again, I mean, I've my Reiki clients, literally, I've had clients like cry on the table, like, really like heal, like do deep inner child work, like subconscious, they didn't even plan on it, but just like healed their inner child. I've had them come in with all sorts of aches and pains and feel better, much, huge stress reduction. I mean, I think it's amazing, 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 but it's still seen as pseudoscience, woo woo. And so I am a huge believer in it, but I just want to be clear for people that are skeptical when I'm talking about you can unlearn your pain, that like, hey, there's still that part of me, I guess, that wants to please to prove, be like, hey, this is not, but yeah, I don't know. So yes, maybe there's a part of me that
No, it's okay. I love the science. I love it. I lean into it heavily, and I love yapping about it. But I think that energy. I mean, like when it goes to Dispenza and Bruce Lipton, who some of the docs don't think he's so scientific. But the question is, this is like thoughts are energetic.
Yeah.
I mean, we're just a different level of energy when it comes to like a table or like I don't know enough to talk about it, but that's a whole nother discussion. And there's so many people healing with energy work, and
yeah,
and let's just move into the placebo. I mean, let's just even talk about the
right,
placebo and the people that just feel better because they have
yeah.
someone to talk to. But another whole other broadcast.
But the placebo is actually evidence based if we're
It
talking about
is. It
that's
is.
been
It
proven.
is.
So that it works,
Yeah.
right? So
And Norman Cousin healed by laughing, so go figure. Go figure. And
whatever. That's right.
I have met people that have healed MS and cancer and tumors shrunk. And so I'm in a position to like be a cheerleader that's like off my rocker. Like I can't do enough cartwheels for this work because if
Yeah.
somebody wants to heal and they really have the belief and the will, they will heal. They were like what was the statement um that the book was called like anyway, I forget the exact name. This woman who healed CRPS, which is like the suicide disease. Like, that we the belief is the medicine, and I'm gonna go on the record with it. I mean,
Me
belief,
too.
the will, and this is chemical. Gratitude is chemical. Compassion is chemical. And if Dr. David Clark can talk about a butterfly on the wall of your childhood, then we're talking science,
Yeah.
So, yeah. So, Marla, I'm happy that you're joining our community. I've never met you before, and Alida, you're welcome to come back. We're here every week, forever. So we're going to round up. And first of all, I do want to apologize because not that I'm a perfectionist, but I don't know what's been going on the last 2 weeks of my broadcast, and I'm really like sad, but I'm like happy that we're here to say goodbye together. And I'm apologizing about the burps along the way. And like someone said to me, I can handle it gracefully, but I'm still pissed that it's happening. I'm going to get a producer. And I appreciate, because this is just the real thing. Like, we're not like NBC. We're just like Tovah and Jeannie and Dr. Deb. And we're just bringing healing to your living room and saying, join us in our, and so I appreciate, all right. Thanks for a great podcast. See, people don't even care
My
about
friend,
the burp.
my friend. Thanks, Tina, for watching.
I wouldn't care
Yeah.
about the burp. I'd be like, it's okay if there was a burp. So, and you have some fans out here, Deb. So you might
Oh,
have to come
I
back.
have some nice supporters. I really appreciate that. That's so awesome. Thank you. I actually think the idea of like maybe you needed a virtual assistant. So just like the pain is giving us a message, like the technological glitches are a sign, like, hey, we're not perfect and it's okay to outsource and get resourced and help. And, it's a good sign to all good. Like, let's see what she said. Thank you. Aw.
I
Yay.
just want to be the host. I don't want to do this anymore. It's a lot. No, it's a lot, and the universe is giving me a big message. Thank you, universe.
But it's also courageous, I have to say, Tova, to go live, which most podcasts don't do. So that is so brave.
Yeah.
People say to me, stop, go on YouTube, do it like the Mindful Gardener's doing, like do what Buglio's doing, and like do it like just come on. And I thought, you know what? There's something very special about being live.
I love
And
it.
even talking to these people, I think there's something very exciting. And I kind of like being unique. It's my ego, like being a little special, a little unique, like what's Doc Tova doing? So I'm going to stay with it as long as my nervous system can handle it.
You're in good you're in good hands. You're in good company.
Well, the
So
idea that I had over 200 and something podcasts, like they think about if each one touches one person, like the amount of the ripple
Yeah.
effects of healing. Like
you
I'm so
cannot believe the people that say to me, I've never met them, and they've seen my broadcast. You have no idea
that's
the
amazing.
energy. It's beyond belief what's happening, and so it's even just and but not even that. But look, YouTube will at some point it will blow up. It's like at some point it'll eat itself up because it's so much. There's so much happening, and I even like have to cut down my my social media time because it feels like a lot. But at some point, it's such an incredible world, this virtual world, that we can connect like this and heal like this. So in the meantime, but we could actually meet here every couple of weeks, like once a month, and bring a patient. Dr. Talia Steed and I, she's in Australia, meet like once a month, and we talk to a patient and we kind of help them get stuck. Like we have a lot we can offer people to just keep, of course, the inspiration, the motivation, the hope, the connection. And we women, we have, look, we could run the world, which we're not going to talk about politics. We could absolutely run the world because we could disagree, we could
Yeah.
agree to disagree, and still run the world.
There you go.
Love
I don't
it.
know Katie, but she said she loves your glitches. That's so awesome. Hi.
Oh, Katie, I love you. She was amazing. Katie's was one of our students. But anyway,
Yeah.
so listen, I want you to leave with a short little message for the listeners. First of all, can they contact you, Deb, if they have any questions? Can they
Yeah. Thank
contact
you.
you
Well,
on
Mark,
LinkedIn or Instagram? Like, where are you lately besides
yes.
Georgia?
So my website and my Instagram is Pain to Peace Healing. So
Oh,
PAIN
you're a hippie. You're such a hippie. Pain to peace healing. You're really a hippie.
PEACE. Hopefully you'll have some peace. You might not be pain free, but you'll have peace with it. So yeah.
Oh my
And
God.
I'm also, you mentioned the virtual world. Are you I'm gonna be at the conference in Boulder, the ATNS conference in September. And are you all gonna be there or
I was there last year. I'm not
uh,
sure if I'm going to be there
okay.
this year.
All right.
Yeah.
So I will
Guess
be
what?
there.
Dr. Loomley is coming to Israel, and I'm
Oh
going to meet him
wow.
on Friday.
That's
There's a
fantastic.
pain conference here.
Oh,
Dan
wow.
Rather's going to be on video. Schruberner's going to be on
That's
video.
amazing.
A couple other doctors are going to be on video, and then Loomley's coming to Israel, and I'm going to meet him Friday in
Oh,
Haifa.
Wonderful. He's amazing.
Haifa.
I love all the
Yeah,
stuff he's doing.
yeah. I haven't taken the course yet, but I'm hearing so much more about it.
Yeah. Highly recommend.
Jeannie, leave us some magic. Leave us some pixie dust from you,
Oh
honey.
my gosh. Just, I mean, kind of like what Jeannie said, like this is a beginning of a whole new life for you. Like it's exciting. It's work. It is work, but it's so worth it. Like it's just to be able to live more freely, more authentic, more joy, more at ease and with less pain. And when you have pain, you know what to do to heal yourself. So I'm really grateful for the work and grateful to be able to share.
Share with us a little bit of your magic.
I would just say the pain's a wake up call. And most people, when they're on the other side, would say it's a gift. And if
Right.
that's super triggering, it's okay because you're in it. But if you can just be open and willing to see things differently, right? I don't see it as a gift. I don't like it, right? But could you just be open to that? If everyone's saying it's a gift on the other side, that you're not there yet, but just willingness to see things differently and just, yeah, it's a huge wake up call. And you don't have to know all the answers, but like Tovah says, like this is me too, like this is the way out. The last thing I'll say is people get really perfectionistic about like which program or which coach or which book. And I just say find something that resonates, you feel comfortable with. Like people spend way too much time. I can't commit. It's not the perfect time, the perfect this.
Yeah.
And that is the TMS, like getting in your way. And like, of course, you don't want to start because who wants to do the inner work? So I would just say, yeah, trust yourself. This is like a lot of the head stuff. This is a lot of over analyzing. This is a lot of just, perfectionism, and just take your next step and lower the stakes. That's what I
Yeah,
would
it's
say.
great advice. Great advice.
both in America, and I'm gonna I shema and go to sleep. So, sisters, fellow sisters, and healers, I'm just so blessed to rub shoulders with you. Thank you again for your savlanut, which means patience. Thank you so much for your patience. We'll meet again, and thank you all for your listeners. So, have a wonderful rest of the day. God bless.
Thank you.
See
Thanks
you.
for the opportunity. Take
Welcome.
care.
1 second.